Hello, my name is Gary Larson, and for the next 15 minutes or so, I want to talk to you about a real alternative to the high cost of health insurance. It's health insurance that you can afford to have and health insurance that you can afford to use. It's actually offered through the Small Business Association of America. The SBA was founded in 1984. It's a nonprofit corporation based in Washington, D.C., with the mission of helping its members lower their overhead costs as much as possible. In that process, they offer discounts on all kinds of business equipment, car rental, car purchases, travel assistance. They have discounts on vitamins, nutritional products, prescriptions, many things. They have a $3,000 accident rider that comes with it as well. There's a unique product called Call MD, which allows you to call in, actually speak to a doctor, and if the doctor's comfortable with his diagnosis from talking to you, he can actually call in a prescription for you. So there's some really great benefits, but in our research, some of our members have said, is there anything you can do to help us with health insurance? It's expensive. In fact, the average deductible purchase today is a $5,000 deductible. And most people will never reach it. They feel like they're buying insurance that they can't really use. So, could you help them? Well, what we did was we created our own policy, and it's really designed for people who own small businesses. By that I mean most small business owners don't run to the doctor all the time. The reason is if they're at the doctor, then they're out of business. So we created a plan specifically for them based upon the kinds of things they said they needed. Once we had that done, we went shopping for an insurance company who would underwrite it. The company we found is called United Teachers Associates, and it's been purchased recently by Cigna. It's called a specified benefit plan, and unlike major medical plans, it really benefits you more than the insurance company. Usually there's no copay when you go see your primary care doctors. It's got a $0 or $500 deductible in the hospital, and as I mentioned, it's got the $3,000 accident rider as well. So here's how it works. It's a unique plan created to beat healthcare reform limitations. As I said, it's offered by United Teachers Associates, and it's designed really to meet the needs of the majority of the population. First of all, we utilize a network called the Multi-Plan Network. This is one of the largest doctor networks in the country. When you go to the doctor, you typically show your card and get your services. That bill is sent to the insurance company where it's repriced to contracted rates. The company then pays its specified amount, keeping your costs low. Here's an example of how it pays. If you go into the hospital, Option A, which has a $0 deductible, is going to pay $1,000 a day to the hospital room and board. Option B is going to pay $2,500 a day. Some people say, well, that seems really low. Well, not when the rates are negotiated. They both also pay an additional $500 a day for the ICU. On option A, the admitting doctor gets $50 a day. On option B, he gets $75 a day. But when you have surgery, the surgeon is going to get 150% of the Medicare eligible charge. Just to put that in perspective, most doctors in this area are contracting at about 135 to 140% of the Medicare eligible charge. We're going to pay 150. Typically, if there's an assistant surgeon, he's going to get 20% of the surgeon's fee, and an anesthesiologist also gets 20% of the surgeon's fee. So it handles surgeries very well. When you go to the doctor, it's going to pay $75 on either plan toward that doctor's office visit. You get 3 visits a year where they pay the $75. For most people, that's plenty. If you go more than that, you're still going to be able to get the negotiated rate. If you have a wellness visit, like you get a flu shot or you go in for a physical, it pays an additional $35 for that visit. The emergency room, it pays $125 or $250, and that's not going to cover an emergency room. But it will cover a walk-in clinic or an urgent care center, which is where we encourage people to go when you're sick. If you're injured, you've got the accident rider to help pay for the larger bills. It also covers pap smears, mammograms, pays $100 a day towards x-rays, $750 a day towards MRIs and PET scans, $250 a day for CT scans, and it pays $150 per day for home health care. So the benefits are great. These are all very close to what the contracted rates typically are. Here's an example of how our hybrid, our specified benefit plan, will compare with a typical major medical. Let's say you went to the doctor because you had a flu and you were on a major medical plan. In our part of the country, the average doctor charges about $130 for a visit if you don't have health insurance. The repriced bill is usually about $65. That's the contracted rate. If you're on a major medical plan, you're going to have a copay. The copays typically are $35 to $50. Let's say this one was $40. Let's say the doctor thought he heard fluid in your lungs, so he wanted to run a couple of x-rays. Let's say the list price was $180, but the negotiated rate was $110. Maybe your copay is $25. So on your theoretical major medical plan, you paid $65 in copays and you went on your way. On our plan, either A or B, let's say the numbers are the same. The office visit without insurance is $130. The negotiated rate is $65. Our plan is going to pay $75. That's right, even though the bill is $65, we're going to pay all of the specified benefit. The x-rays, we pay $100 a day towards x-rays, but the negotiated rate was $110. So we actually paid $175 to that doctor, and $175 was the actual renegotiated bill. So you went to the doctor, had your x-rays, and it cost you nothing. That's better than paying a copay. Let's say you have a theoretical gallbladder surgery. Let's say it was a 3-day stay. Well, a hypothetical bill for someone without insurance might be about $31,000. The negotiated rate, let's say, was a little under $12,000, about $11,800. If you had a $5,000 deductible, you would pay the first $5,000 of that $11,800. You would then pay 20% of the difference in the bill, which means you'd pay about $6,500 on a typical major medical plan. If you went in on our option A, which has a zero deductible, 3 days in the hospital at $1,000 a day is going to pay $3,000. The admitting physician gets $50 a day times 3 days is $150. It pays the same surgeon, assistant surgeon, and anesthesiologist, whatever their bills are, the contracted rate. So a total payout of $10,150. But the negotiated bill was $11,845. In this case, you're going to pay the difference, which is $1,695. Far less than what you would be paying under a typical major medical plan. If you are on our option B plan that pays more in the hospital, it's going to pay $2,500 a day in the hospital, so 3 days is $7,500. It pays $75 a day to the admitting physician, so it's going to pay $225. It's going to pay the same surgeon, assistant surgeon, and anesthesiologist, so it pays a total of $14,725, but the bill is only $11,845. The option B plan has a $500 deductible, so it takes the $500 out, and then it's going to write you a check for the overage. You're actually going to get a refund of $2,380. Now, most surgeries, in fact, today are not done in the hospital. About 80% are done on an outpatient basis. The top 10 outpatient surgeries in the United States, according to the Healthcare Blue Book, are listed on this page. you can see the average charge according to the Blue Book that is actually negotiated and actually paid. Under option A, it shows what we pay. Then you're going to see that in red, later you're going to get a bill for the difference. It doesn't quite cover the whole bill, but in every case, you're going to pay under $800, which is far less than the $5,000 deductible. If you had option B, we pay more because we're going to pay the same daily hospital rate to that facility, even though it was an outpatient service, so we're paying $2,500 on top of the surgical fees. So in every case, we overpaid the bill, and in each case, you would later get a refund. So if this makes sense to you, and you'd like to see what the cost for you and your family would be to have this plan, well then give me a call. My contact information is listed here. My phone number is 941-840-1889, or you can look me up on the internet at minnesotainsurance.com, and my email is gary@minnesotainsurance.com. Thank you. Bye.